Hi everyone, if you are a traveler who likes to travel to places which are 6,000 feet and higher in elevation, then this video is for you because I'm going to cover everything that you need to know about high altitude illness called HAI. So let's get started. Welcome to this second episode of Medical Tips for Travelers. Today I'll be talking about high altitude illnesses, the things that can happen when you are above 6,000 feet. Just to give you my background and what qualifies me to talk about these three things. One is I'm a board certified doctor here in the US since 1998 and I practice emergency medicine. I started my medical school in 1986, so almost 4 decades of medical experience. The second thing, as of today, recording this in May 2025, me and my wife, we have traveled to 65 countries, all 7 continents, and 8 territories. So we have extensive travel experience also. And the third thing is that I have trekked Everest Base Camp. So I know exactly what high altitude means and what can happen. I'm going to even talk about a little bit of personal experience. So you will get all the information about the different illnesses, how it happens, and how you diagnose, how you prevent, how you treat, everything you're going to get. Just stick around till end to get all the nuggets. Okay, so before we go further, need to take care of this disclaimer. I'm not your doctor, so I cannot give you official medical advice. You need to follow your own doctor's advice for any specific medical condition or situation that you have. Whatever I'm sharing here is just a good faith information based on my knowledge and experience. You take it the way you want to take it at your own risk. Okay, so let's go ahead and get started. So I'm going to briefly explain to you how this thing happens. It's all about oxygen. Your the cells of the body not getting enough oxygen, but exactly how it happens. So at sea level, the air that we breathe, it has got 21% oxygen. That oxygen goes through the nose, through the windpipe, it goes in the lung. Then when it reaches the lung, then outside the lung, alveoli, then there is a capillary. So the oxygen goes from here to capillary, and in the capillaries there is blood flowing. So that oxygen gets mixed with the hemoglobin. So basically it takes along the hemoglobin, and some of the oxygen gets dissolved into the blood, and that's how it gets carried ultimately to the cell, and then cell gets the oxygen out and sends the carbon dioxide back. So this is in the simple term how the oxygen reaches to your cells. What happens at the high altitude, the higher and higher you go, the percentage of the oxygen in the air keeps going down, 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 and down. Okay, and what happens that when it goes down, the pressure of that oxygen that pushes the oxygen through that alveoli into the capillary, it is not that enough. So it cannot process enough oxygen to go to the cell. So when that happens, the brain doesn't get enough oxygen. So that is how you get acute mountain sickness, like you get confused and things like that. But when the lungs don't get enough oxygen itself, then basically it starts leaking things out, and same thing happens in the brain, because these are the two vital organs. So the body shuts the blood from everywhere else because you don't need that much oxygen right now in the hand. The top priority is lung and brain. So that is where the most of the damage happens. So this is in simple term how the high altitude illness happens. So if you remember one thing, the name of the game is oxygen. Your cells are not getting enough oxygen. So logically, you know what is going to be the treatment? Oxygen. So what are the risk factors for high altitude illnesses? Well, if you had it before, that becomes a risk factor. Or if you climb too fast, like more than 1500 feet per day, that is a risk factor. If you did a vigorous exercise before you climb 1500 feet that day, that can be a risk factor. Or if you consume alcohol or drugs or did not get enough sleep, that is a risk factor. And if you have any other medical condition like COPD or any muscular disorders, that can become a risk factor for high altitude illnesses. And typically it doesn't happen below 5,000 feet. It typically starts 6,500 feet mild symptoms, and if you go beyond 9500, there may be moderate symptoms, and obviously above 13,000 there is a good chance that some people will develop high altitude cerebral edema, that is a brain edema, or the lung edema, that is a HACE and HAPE, that is a high altitude cerebral edema, high altitude pulmonary edema. So these are the risk factors. We're going to talk about different high altitude illnesses. The first one is called AMS, that is a acute mountain sickness, that starts 6 to 12 hours after you reach the height of 6,500 feet, and it lasts 1 to 2 days, and typically it feels like you have a hangover and some headache, nausea, not feeling well. So those kind of minor symptoms. The second one is called high altitude cerebral edema, that means the brain edema, the brain swells. So when that happens, it progresses from headache to dizziness and confusion, and eventually you can become comatose. So that is a serious part of the same illness that starts as a acute mountain sickness. And then the third one is high altitude pulmonary edema, that is the lung is flooded with the water. So the common symptoms is breathing problem, right? So that is the third thing. And the fourth one under that category, I'm going to put few different things, is irregular breathing, because sometimes you can breathe like that. So very irregular breathing can happen at high altitude. The second thing is the retinal hemorrhage. The retina, behind that there are blood vessels, and it can burst and you can have an hemorrhage. The third thing in that category is, some of the conditions, like if you have a heart issues, it can get worse. So these are the different illnesses that can happen at high altitude. So how do we diagnose it? For acute mountain sickness, obviously you will see the patient is having headache, hangover kind of symptoms, dizziness, and not feeling well. So those are the things that you will look for. That's how you diagnose. There is no specific test for it. For the high altitude pulmonary edema, obviously the person will have shortness of breath, he'll be coughing, mostly dry cough. Then as a doctor, we can listen and we can hear some crackles. Obviously, when you check the oxygen will be low. It may be sometimes 40-50%, but typically it is at least 10% less than the normal person. So that's how you know that the person has a high altitude pulmonary edema. And obviously when you do the chest x-ray, you can see it is all flooded with the fluid. So those are the things you can diagnose high altitude pulmonary edema with. Then high altitude cerebral edema, so you will see the patient will be kind of wobbly and dizzy, and sometimes not making sense, and in the worst case scenario, comatose patient. So you know that there's something wrong, right? Then you can do MRI of the brain if it is available, which is I doubt will be available at that height. And the same thing, you can do the lumbar puncture to check the pressure. There is no specific blood test for it. So in nutshell, most of the time we diagnose all these three conditions just by taking the history and looking at the patient, because there are no magical tests that will tell us 100%. So how do we prevent high altitude illnesses? You will be in one of the two scenarios, the one where you will have time, the other you won't have a time. So for example, when I went to Everest Base Camp, we had a time. So in that scenario, ideally you should not climb more than 1600 feet per day, and every 3200 feet you should have 1 day rest. So basically climb 2 days, rest 1 day. So that is the one thing you can do. The second thing is climb high, sleep low. What does it mean is that, for example, we stayed at Lukla for a couple of days. We made a day trip to around 1,000-1,200 feet, came back, spent the night in Lukla in Nepal. That was kind of a halfway to Everest Base Camp. That is the third thing you can do. Like if you're expecting to, let's say, climb 13,000 feet, you can spend few days at around 8,000-9,000 feet height and let your body get acclimatized. Or if it is possible, for example, if you plan to ski, maybe you can make a weekend trip like for few hours and come back, go and come back like that. Do it few times and let your body get used to that kind of low oxygen level. And then there are intermittent normobaric hypoxic environments available where you can expose yourself to low oxygen level, and like it's an artificially you are creating that oxygen level that you encountered at the high altitude, because sometimes it's not practical for you to go to those places to get used to it, right? So these are the options available. Now, after saying all those things, if you want to remember one thing, just remember that go slow is going to be the name of the game. And if it is not possible, then obviously you can take help of the medications, which is acetazolamide, which is a Dimox. You can take 125 milligrams twice a day, start a day before, and continue to take it. And you can also take dexamethasone, 2 to 4 milligrams, 6 to 12 hours by mouth. It's steroid basically. So those two medications can help prevent high altitude sicknesses. And for high altitude pulmonary edema, you can take one more medicine that is called nifedipine, because that helps kind of release the soft tissue muscles in the lung. So there are a few medications available that you can take to prevent all these high altitude illnesses. But if you don't have much time, in that case, obviously you have to take medications because there's no time to get used to the new environment. Now let's get to the treatment of these illnesses. The first is acute mountain sickness. If it is a mild sickness, meaning thereby you have a hangover like feeling, headache, nausea, dizziness, then obviously stop going further up. And you can take ibuprofen or paracetamol for headache. And if you have nausea medicine like Zofran, like ondansetron, you can take that also. If you have oxygen, feel free to use that. And you can also take acetazolamide, the one that we talked about earlier, Dimox, that will actually help with the sleep. If the symptoms are moderate to severe and you cannot take it anymore, then obviously you have to go back down, okay, 1600 feet at least, but if possible 3200 feet, because that will most likely resolve your acute mountain sickness. And obviously you can continue with acetazolamide and oxygen also while you are going down, because that will help with the symptoms. So that's in nutshell the treatment for acute mountain sickness. Next is a treatment for the high altitude pulmonary edema. Two things you have to remember here is that you have to keep the person warm, because if it becomes cold, the lung problem will get worse. And no exercise or no walking or nothing, just rest. So those are the two important things. And on top of that, obviously the oxygen is going to be a standard treatment for all these three illnesses, but more here because it's a lung problem. Then you can use the medications like dexamethasone, the steroid we talked about earlier, then another medicine called nifedipine that typically we use for the blood pressure, but here it helps with the swelling in the lung. And then another medicine you can use actually is the Viagra. Yes, Viagra and Cialis you can use in this particular case to help with the lung problem. So these are the things you can do before you get the helicopter and transport the patient to the nearest hospital. But bringing the patient down as fast as possible is the key. So the next treatment is high altitude cerebral edema. That means patient is either wobbly or comatose or confused. The most important thing you can do is come down at least 3300 feet if physically possible, because sometimes it may not be possible. In that case, you can continue with oxygen to maintain the oxygen level more than 94%, and you can give dexamethasone and oxygen. These are going to be your three main important treatment for the cerebral edema, and transfer the patient to as soon as possible to the nearest big hospital. Now you will always find some grandma's remedies for these high altitude illnesses. So those are not scientifically proven, but take it at your own risk. Some people take ginkgo biloba, the herbal supplement. When we went to Peru, in Lima, when we were walking around, people came to us trying to sell us the cocoa leaves, saying that, oh, if you take this, when you go to Machu Picchu, you won't have any problem. So you take it if you want to, it's up to you. Then some people take iron, some people take nitrate, some people take Viagra, all kinds of stuff people take. And some people even go to oxygen bar, they take the oxygen before going up. Nobody knows whether that helps or not, but if your heart says it helps, well, I guess it doesn't hurt much, except maybe cocoa leaves. So take it at your own risk, but these are not scientifically proven ways to deal with high altitude illness. If you can remember only two things, oxygen and go slow when you're going up, and if it happens, come down. As simple as that. So that's it, guys, about high altitude illness. If you experience any of this while you climb beyond 6500 feet, do share your experience and what did you do in the comment section. Hit that like and subscribe button if you're not already done so. And if you can share this video with somebody that you think will benefit, that would be great. And I'll see you in the next video of this series, medical tips for the traveler. So thanks for watching.